if there's one downside of the job I have, it's sometimes that we just say the same message over and over, no matter who the person is. It's also the magic of this diet is it does have so many benefits across a wide range of chronic diseases. So yes, diabetes, heart disease, these all have to do with they all kind of come back to the amount of fat a person has in their diet.
Staten Islander News is here today with Noah Praamsma. Noah Praamsma, MS RDN, is a nutrition education coordinator with the Physicians Committee for Responsible Medicine, a Washington, D.C. based nonprofit organization dedicated to promoting preventive medicine through plant-based nutrition and higher standards in research. A native Vermonter, he does his best to act locally and think globally in both his personal and professional life. Noah completed his undergraduate degree in biology pre-medicine at Calvin University. During this time, he developed a passion for plant-based nutrition and preventive medicine, as well as the ethical treatment of animals and environmental sustainability. He went on to earn a Master of Science in Dietetics from the University of Vermont with a focus on community nutrition and sustainable food systems. Noah's other past professional experiences include as a special supplemental nutrition program for women, infants, and children, WIC public health nutritionist, public policy coordinator for the Vermont Academy of Nutrition and Dietetics, and several roles with the city of Burlington, Vermont, including a term in AmeriCorps and director of a nutrition-focused summer camp with Parks and the Recreation Department. So good morning, Noah. It's good to have you with us.
Hey, thanks for having me. Great to be here.
So, basically, the focus of today's conversation is going to be on heart disease and aging, and how plant-based nutrition, as well as exercise and other changes, can contribute to either preventing or reversing these conditions. Um, the first I wanted to talk about preventing the need for interventions such as like statins for high cholesterol, blood pressure medications, and surgeries such as pacemakers, mitral valve repair, and things like that through diet. So if somebody has been diagnosed with any of these conditions, are there proven methods for reversing or reducing these conditions?
Yeah, thanks for that question. So yes, I don't know, sort of in short, there's a lot a person can do to, depending on their condition, to either prevent the continuation of the worsening of that condition, or in some cases even reverse it. Some heart conditions have most of their origins are in more genetic places. So in those cases, we still encourage a heart healthy diet. But it really there's a sort of some variation depending on the condition. But speaking generally, cardiovascular disease related to high cholesterol is one of those sort of prime examples of a disease that can be addressed through diet-based approaches. I and my organization advocate for a plant-based, oftentimes called a healthy vegan diet. So this would be foods based off of if you imagine your plate filled with legumes, whole grains, fruits, and vegetables. We like to think of those as the four food groups that really give a person all of the nutrients they need, and also that it's a really powerful antidote to a lot of the leading chronic diseases for Americans. So thinking about cholesterol specifically, we know that the more cholesterol you have in your body, in your blood, we see the development of that's correlated to the development of plaques, which then can lead to various types of heart disease. Think stroke, heart attacks. Anytime those plaques actually obstruct the flow of blood to vital organs, that obviously is a really bad thing. So the things that raise cholesterol, saturated fat is the primary driver. Also, for plenty of people, eating cholesterol from things like eggs also contributes. So by removing animal products, which are the main source of saturated fat and exclusively the source of cholesterol, we can see people reduce the amount of cholesterol that they've got going in their body. We see the lessened and even eliminated need for statins with a lot of folks. And of course, we're talking about cholesterol, which is sort of this this intermediate risk factor. Like you can have high cholesterol, but if you never have a heart attack, it's not maybe the end of the world. But we do know we know it's a step that if we can interrupt kind of it, we can stop a lot of those bigger events from happening. So yeah, hopefully that gives you a little bit of a primer on what's possible.
Right. And so when you're talking about cholesterol from like animal-based products, you would be talking about the kind of one that's like HDL, I think it is. This is like the bad kind of cholesterol because I'm sure that you know, like, and but not all of our audience knows that your brain is also made of cholesterol, which is why it's important to have LDL cholesterol in your body. Would you suggest like plant-based sources of saturated fats to be replacing the animal-based saturated fats that people were getting?
It's a really good question. And I'll just back up a minute and say, so there are two types of cholesterol, high density lipoprotein and low density lipoprotein, shortened, as you said, to HDL and LDL. So HDL is usually considered the good cholesterol. The reason it's good is because if you also have high LDL, which is the bad cholesterol, the high HDL can be slightly protective against some of the worst outcomes. So the three numbers that you usually see in cholesterol tests are, like you said, HDL, LDL, and total cholesterol. And plant-based diets, because they tend to be lower in saturated fat, do reduce primarily LDL, the bad cholesterol, also total cholesterol, because if you think about it, you're reducing, a fraction, you're going to reduce the whole as well. And it tends to reduce to a lesser degree HDL. And that can get some people a little bit nervous for a few reasons. One is that they are so accustomed to hearing HDL referred to as good cholesterol. So the thinking is if you're losing your good cholesterol, that's a bad thing. Really, the only reason, again, that it's good is because it can be protective if your LDL is low, if your bad cholesterol is low. So if you're reducing your total cholesterol, that's still a really positive thing. You mentioned the need for cholesterol in your body. It's true. Your cells use it to in their cell walls. Of course, your brain has just a lot of cells with a lot of cell walls that are very important for their functionality. But your body makes all the cholesterol that it needs. So it is a bit of a myth out there that you need to be eating dietary cholesterol, things like eggs, to fill to meet those cholesterol needs, or even saturated fat. All fats have some small degree of saturated fat, and if a person is eating a vegan diet or a whole foods diet made up entirely of plants, they're getting all of the fat they need. Their body is going to be able to make that cholesterol without problem. So there's really not a risk there of cholesterol deficiency. That's unless you're starving, that's an unheard of thing.
Okay, cool. And I noticed that when we did the cooking session with the other person from your organization, he used avocados and he called them like a power food. Do you guys also do you also recommend to your patients that they have avocados or coconut, like if they
Mhm.
want to have like fats or something like that to have those?
Yeah, that's a good question. So it kind of depends a little bit on a person's health goals. So avocados and coconut are two really great examples of different types of fat that you find in plant-based foods. So if you think about, I don't know if hopefully maybe some of your listeners have seen avocado oil before. So if you get it extracted from the avocado, it's going to be liquid at room temperature. And what that means is that fat is primarily unsaturated. Sometimes this gets referred to as healthy fats. I would probably say healthier fats. They're better than the alternative, which you would be an example of which would be coconut oil. Or coconut products in general. So if you've seen coconut oil before, it tends to be solid at room temperature, which generally is an indicator that it's high in saturated fat. So saturated raises your cholesterol, unsaturated doesn't have that same effect. I mean, a person could have conceivably small amounts of coconut in their diet and be fine. I'd say generally you want to keep coconut products low or even eliminate them completely, especially if you're a person at risk of high cholesterol. Avocados would be a much healthier choice in fat if you're looking for that. But even with them, there are some people or some conditions where we even dissuade people from even high fat plant foods like avocado. We do a lot of research with low fat vegan diets for reversing type 2 diabetes. And if you are a person with high A1C, hemoglobin A1C, maybe you've received a diagnosis for pre-diabetes, or even full-blown diabetes. Those folks in that situation, to them, I would generally recommend removing or at least very much minimizing, of course, the animal products, but also some of the higher fat plant foods. Definitely coconut, also avocado. We even say take a little bit of a break from the nuts and seeds because those also are pretty high in fat. Generally a healthy food, but if you're using diet to try to prevent the progression or even to reverse type 2 diabetes, removing high fat foods is going to be very much to your advantage.
Nice. So if somebody has, like, which is a very common situation, they have type 2 diabetes and heart disease, like high blood pressure. So they're on whatever those A1C medicines are for diabetes, and they're on like either a statin or they're on like the other blood pressure drugs, and they want to use diet to reverse both of those conditions. Is it kind of like the same diet would work for both?
Yeah, we tend to sometimes if there's one downside of the job I have, it's sometimes that we just say the same message over and over, no matter who the person is. It's also the magic of this diet is it does have so many benefits across a wide range of chronic diseases. So yes, diabetes, heart disease, these all have to do with they all kind of come back to the amount of fat a person has in their diet. We try not to be overly fat phobic. Any foods added. We try to understand that fat has a place in the diet, but it has a place as a part of whole foods. And so when you think of olive oil, people talk about it being healthy. Well, maybe the healthiest source of olive oil is actually olives. You're still getting some of those fats, not nearly as much, but you're also getting these amazing plant compounds, polyphenols and antioxidants that only really exist in their highest concentration in the olive itself. So we do encourage just choosing those whole foods as much as possible for a variety of diseases.
Right. And also there's a whole book that actually has 5 sections. One of the sections, it's called Real Food, Fake Food. And one of the sections is about olive oil. I was just watching yet another YouTube video about all the fake olive oil that's either it's not real olive oil. And so there are a few good brands that people can buy. But like what you were saying, like with olives themselves, just replacing the olive oil with olives themselves, and you'll be getting the fats plus the whole food that it's coming from.
Exactly.
And also, in your experience, when you talk to people and you work with people to, reverse heart disease and diabetes who are actually already on medications, do you find that when they go for their tests, like they get to lower their medications as they progress on this diet?
Yeah, that's a big part of what we do in our research studies. We bring in people who, again, I'll use the diabetes example, people who are on metformin or insulin, and we kind of begin this diet with them and coach them how to eat breakfasts, lunches, and dinners using whole food, low fat, plant-based options, and slowly we start seeing their blood sugars come down. And it gets to a certain point where they're moving into the range of hypoglycemia, which is low blood sugar. And of course, that's not a good thing either. So we try to keep them in the sweet spot. And usually that involves coaching them on how to go back to their doctor and say, hey, I'm following this diet, I'm seeing these changes. Can we revisit my medication dose, start lowering it? And eventually, many people are able to get off it completely.
And that's based on their blood tests and their doctor agreeing, yes, you don't need this as much anymore. Talk
Exactly.
about
Yeah.
Sorry. I want to talk about two specific conditions that are heart-related conditions that there's the possibility of preventing or reversing, whether there's the possibility of preventing or reversing them with a plant-based diet. So the first one I want to go talk about is mitral valve prolapse and other physical deteriorations of the heart muscle and tissue. Are there any ways to prevent or reverse that using diet and nutrition?
Yeah, it's a good question. So if listeners aren't or viewers aren't familiar, mitral valve prolapse is this condition where these valves in your heart that keep blood from flowing in the wrong direction start kind of stretching out, and blood will bulge back upward, kind of into the heart in the wrong direction. And that can progress to those flaps kind of losing their closing capacity, and then blood actually does flow backwards. It has the disease itself has most of its risk factors related to other things. I think generally we see that a healthy diet I mean, we recommend to everyone a healthy diet that's going to be beneficial for their heart. If you're not doing that, it seems like there's probably a higher risk of developing mitral valve prolapse. If a person has been diagnosed with it, eating a heart healthy diet is still going to be recommended. There's a lot of ways that both diet and exercise together can just allow the heart to function better. It makes it stronger, fewer pumps. The sort of displacement value of how much blood the heart can pump through at any given time. If the heart's stronger, it's able to just be more efficient. So a generally well-functioning cardiovascular system is going to be beneficial for it. You can think also about things like lowering blood pressure. Blood pressure really just exacerbates a lot of conditions. So if you can have a healthy blood pressure, that's going to be really beneficial for it. I'm just thinking through even too that we find plant-based diets, ones that eliminate animal products and really lean into those healthy plant foods, actually make your blood a little bit thinner, or it allows it to flow more easily. So again, just another reason to be choosing plants over animal products, and just setting yourself up for heart success.
Awesome. And a similar question for the condition sick sinus syndrome, which some recent research has shown that it might be related to the strength of the muscle. And it's where the heart beats irregularly and actually pauses, throughout the day and usually throughout the night, but where it stops beating.
Yeah, that's another one where if we look at the risk factors for it, they are all things that have to do with diet. So high blood pressure, high cholesterol, high body weight, and all of those kind of have to do with, of course, diet. Also lack of exercise. If a person can be eating well, moving frequently, getting their heart rate up, and of course using exercise also to maintain a healthy body weight, those things are going to reduce the risk of developing sick sinus syndrome in the first place. There's, like you said, there's also been some research just finding that eating a heart healthy diet is generally beneficial for reducing the risk of developing it. Also things like not smoking, not drinking alcohol, or at least keeping it very moderate, and general stress control. Oftentimes, even things like stress do tie back to diet as well. Just the way your body processes stress of any type, whether that's physical strain on your body or mental strain, there is a whole pathway of oftentimes inflammation that your body has to deal with, that is its own type of stress. And by eating a plant-based diet high in these antioxidants that help moderate and control the downsides of stress, we just see benefits all around. So I think as I've done some research into this, it seems that the Mediterranean diet is a very popular one. Of course, people hear about it all the time as one that's highly recommended. So it's a very well researched diet, and some of the research has found that the Mediterranean diet definitely beats what we might call the standard American diet, which tends to be high in fat, sugar, salt, cholesterol. But we find that even a plant-based diet and all of the research that we've done tends to take the best things about a Mediterranean diet and really just carry that even a step further. So we really highly encourage moving to your plate towards more filled with more plants rather than animal products, just because there are so many benefits for heart health, and we definitely see that show up in SSS or sick sinus syndrome.
Awesome. And so kind of in general, and based on the research, what are the benefits of a plant-based diet to heart health and aging in general for people who don't have heart conditions, but have other conditions of aging?
Yeah, well, there's quite a few of them. So we've talked a lot about heart disease, cholesterol. Sometimes it's even just helpful to put this in the context of longevity, like who is living the longest. And one of the really helpful places to look as to understand how that works are these things called blue zones or places. Blue Zones was the name of a book that came out. A researcher named Dan Buettner. Listeners or viewers may have heard of him or his book. But essentially, these blue zones are places around the world where where special communities have a dramatically higher number of people that live to over 90 years or even over 100. So we call them centenarians. People that reach 110, we call them super centenarians. So places like Loma Linda, California, there are a couple in Greece, Japan, and what all of these places have in common are, I mean, there's a couple things. There are social factors, like they tend to be very community oriented, low levels of stress, just strong relationships, regular exercise. But also really notably, they tend to be very plant-based diets that these people follow. So the one that we have in the United States, this one in Loma Linda, California, it's a group of, it's kind of a subset within Christianity of called Seventh-day Adventists. And their sort of interpretation of some scripture passages lead them to believe in really reducing and for many people, even cutting out meat. So we see a really high percentage of vegetarians and vegans in these communities. And they've been the source of some really fantastic research, all of which shows that the lower you eat on the food chain, i.e. the more plant-based or more vegan a person eats, the longer they live. But it's not just length of years. We sometimes say it's the health of those years as well. So the rates of all of the diseases we've been talking about are much lower. So that shows up in, of course, diagnoses, but in our work, we talk a lot about some of the other benefits like skin aging. There's a lot of research showing that a plant-based diet is really beneficial for just the health of your skin. And especially as we age, the health of our skin kind of represents our health as a whole. It gets a little bit more challenging to fight off diseases. So if we have a strong physical barrier against infections, we're much less likely to be suffering from infectious disease as we get older. There's a couple of reasons why this happens. Plant-based diets are high in magnesium, which is really great for this sort of acid that you produce that helps retain moisture in your skin. We even see benefits of plant-based diets for your body's own ability to produce collagen. Collagen supplements are a really hot topic, and plenty of grocery stores and supplement companies try to sell you on them. But a plant-based diet that's rich in vitamin C and that has all these antioxidants really supports the body's ability to produce its own collagen. It's also a lot cheaper, and you get all of these other benefits rather than having to, zero in on a supplement that may or may not have some weird side effects. So we're all about using food to its full potential to really facilitate healthy aging, for years and years to come.
Oh, cool. And so, how can someone ensure that they're getting all of the nutrients their body needs from their diet, particularly if they're on like a plant-based diet, and you want to make sure that you're getting enough protein, getting enough everything else that you need?
Yeah, it's a great question. So I mentioned earlier on the four food groups that we really try to promote as the four main sources of, or the four sources of our what to put on our plate every day. So fruits and vegetables, I think most people are familiar with those. They of course are just packed full of vitamins and minerals, and are I think everyone knows that the more, eating more fruits and vegetables is a good thing. Um, every once in a while there's some weird health trend out there that says fruits are bad or something, but research repeatedly shows that that is not the case. The next food group was grains, specifically whole grains. This one gets a little bit of there's some hesitancy maybe among some, I'll say, especially folks who are trying to go low carb, are just a fantastic source of complex or healthy carbohydrates, carbohydrates that your body uses in a really even, measured way. They don't spike your blood sugar like refined sugar would. Whole grains also tend to be surprisingly high in protein. So it's really not it's not to be overlooked, the fact that whole grains are such a great source of that. Magnesium as well, I mentioned, is another good one that you'll find in grains. Some B vitamins as well. And we really do, again, recommend the whole grain options as much as possible. So think things like brown rice, oatmeal is another whole grain. You can buy whole wheat pasta, whole wheat bread. These are wheat products that have retained their whole, the entirety of the grain rather than being processed to a sort of more refined version. Quinoa, there's so many grains out there to explore. So we encourage eating them plenteously and in a diversity of grains as much as possible. And then the last one, and one of my favorites, is legumes, beans, peas, lentils, anything that you can buy in they come in cans, pre-cooked. You think of chickpeas, black beans, kidney beans, white beans. You can also often buy them dried, especially if you have a pressure cooker. They're a really great, it's a really great way, a very economical way to get your beans in every day. And beans are incredibly high in fiber and protein. So especially for someone who maybe is either an athlete and needs higher protein intake, or who is getting a little bit older and knows that protein is important for healthy aging, really being sure to get regular amounts or regular servings of beans. I mean, you could shoot for every meal of the day. That's my routine as much as possible. There's many ways to integrate beans into all sorts of meals. But yeah, legumes as a category are a really important fourth piece of the puzzle. And putting all of those four food groups together really leads to a fantastically balanced diet. People, are easily able to get all of the protein they need. It's an amazing amount of fiber, which is a nutrient that so many Americans overlook these days. The one thing that you would want to add on to a whole food plant-based diet in terms of supplements is a B12 supplement. Really, anyone over the age of 50 should be taking a B12 supplement. If maybe a doctor has prescribed that already, if that is true of you in terms of your age. But as people get to around 50 years old or older, their stomach acid just changes in such a way that it's harder to process that vitamin B12. And for vegans, it's really that you just kind of need a supplement. Some foods are fortified with it, but the safest and most reliable way to get it is just a quick daily morning supplement. It's really easy. They're a pretty affordable supplement. So we do recommend that just for blood and nerve health. It's a necessary addition for those of us who eat this way.
Oh, nice. Okay. So that makes sense. But even people who don't eat this way should also be taking a B12 supplement. Like that's like a universal requirement for everybody over like 50 years old.
That's the recommendation, yes, for anyone over 50.
Okay. Yeah, because that makes sense because they say that, people do get it from meat, but it's kind of like if you cook it, you destroy it. So it's like the only people getting it from meat
Mhm.
are those who eat raw meat, like or sushi or something like that. So it's kind of like nobody is getting it, in other words.
Yeah, I would need to refresh on whether I don't believe that cooking denatures or destroys the vitamin. But it's still, just yeah, again, if you're I feel like the majority of the population at this point probably would benefit from it. And unless you're taking a very high dose, there's really no risks of overdoing it. So just look for those sort of moderate dose options in your local CVS or pharmacy. And if it is some very large dose, well over in the thousands of milli or micrograms, you would want to maybe just take it every other day, for example.
And also the B12 is not something that they normally test for in like those annual tests where they do test for
Mhm.
vitamin D deficiency at this point, and calcium and magnesium and stuff. But I don't think that I mean, you can request it. Like people can request to know if their B12 levels are low because I also know people
Yeah.
who have it in their blood tests, but it's not part of like that standard one that they do for people every year. So it would be something you would have to find out if you're low in. And also, I wanted to mention that for people who are on Medicare, which you're over 65 then, and on the health insurance, most Medicare itself authorizes people to visit a dietitian themselves, so that they can get like specialized recommendations for their own particular conditions. And PCRM also has a directory of dietitians that we're going to put into the article as well, so that people, if they want to go for a dietitian that advocates for a plant-based diet, such as the kind that we were discussing today, they can go to their own dietitian and then maybe start their own plan and bring their information to their doctor and get off their medications if that's their goal. It's not everybody's, not everybody has the same goal, but everybody can go see a dietitian over 65 if they have Medicare.
Yeah, we're grateful for that provision.
Um, and so, was there anything else that you would like to add today, either about a heart healthy diet or aging, or anything that you don't think that we covered enough?
I was just remembering as you had asked about foods to, or ways to ensure getting adequate nutrition. There are a couple things that we do normally, specific foods that we like to recommend people towards. So specifically for calcium and iron, beans and leafy greens, those two rhyme. They clearly belong together. Those are really fantastic foods to getting those two important nutrients. So, on a vegan or plant-based diet, it's very much possible to get all the iron and calcium you need. We just recommend regularly consuming beans, like I already mentioned, but then those leafy greens, especially dark leafy greens, if you can get your hands on them. So, any sort of thing of spring mix or kale, collard greens, arugula, there's many to choose from. Spinach as well. Though spinach, every once in a while, people get a little bit nervous around because of these things called anti-nutrients. But really, just eating a moderate amount of spinach is not going to be an issue. One other thing that I'll mention too, and a question we oftentimes get, has to do with omega-3 fatty acids. It's a type of fat that your body can't always make on its own. So it does need to come from some food source. The thing most people think of when they think about getting their omega-3s is fish oil supplements or just fish generally. But omega-3s also come from plants. In fact, most of the fish or the omega-3s that fish got came from plants in the first place anyways. So the way we recommend people get it is through taking about 1 to 2 tablespoons of either ground flaxseed, chia seeds, or hemp seeds. All of those are pretty easy to find in most grocery stores. And if you just sprinkle a tablespoon of chia seeds on your morning cereal or oatmeal, or blend some ground flax seeds into a smoothie, that tends to give you a great dose of of the omega-3s that you need, and your body will kind of do the rest, make the necessary versions of that that fat from what you get in those seeds. It is, however, occasionally there are some people who don't convert the type of omega-3 that you get from those seeds into the other two types. So if you are a person who follows a vegan diet, congratulations, you're doing great. Maybe next time you're at your doctor or getting some lab work done, just maybe mention that you'd be interested in getting your omega-3s tested as well. And that can be a helpful just sort of way to check in, make sure that you're staying on track.
Okay, great. And also, I think you can also get omega-3s from algae as a vegan type of supplement for them.
Yes.
And so for people who like the taste
Yeah,
of
so that would,
algae.
yeah, the you can, yes, you can definitely eat it through whole algae. If your omega-3s do turn up low, algae-based supplements could be an option as well. So that would avoid having to eat too much seaweed if that's not your cup of tea.
Awesome. And do you guys recommend that the leafy green vegetables are cooked or raw or both?
I think however you are most likely to eat them is how we usually phrase it. So if you like your spinach steamed or your kale sort of sauteed with a little bit of vegetable broth on a nonstick pan, like eat them however you're most likely to eat them. But raw is definitely a great option. One plug I will give for raw leafy greens in particular, of course, you tend to chew raw food a little bit more maybe than cooked food. And the more you chew, or if you're the act of chewing.
So, you were talking about the importance of chewing when it comes to raw versus cooked foods.
Yes, yeah. So it's understandable that when you're consuming raw leafy greens, you're going to be doing a fair bit more chewing than cooked greens. So just the act of chewing, actually, there's a reaction that takes place between your saliva and the leafy greens that produce this compound nitric oxide that once it starts getting into your bloodstream has this really cool effect of actually relaxing your blood vessels. And so this allows them to be more reactive to changes in blood pressure, just overall creates for a healthier circulatory system. So we highly recommend making sure you get your regular greens in and giving them a good couple chews when you do.
Oh, awesome. And I know some of our readers are not quite ready for like a plant-based diet completely. Are there specifically like steps that they can take, like replacing red meat with chicken or red meat with fish that would be more, better for them than the standard American diet and can help them on their way to getting to a plant-based diet, which is the ideal?
For sure. Yeah, I think, it's for many people, small steps are a great first step. And so, yeah, looking specifically at red and processed meat, those tend to be some of the most challenge or detrimental health, unhealthy foods that Americans eat. So, unfortunately, or actually, I should say, fortunately, there are so many great alternatives to things like burgers. We've got lots of plant-based, whether it's more of a whole food, sort of homemade black bean burger, even switching it out with one of the more sort of what we call like transition fake meat products. That can be a really positive change. So yeah, think about those red and those processed meats. And then maybe also just some easy changes. I think about there's a lot of Americans. I grew up in a rural corner of New England where people drink a ton of milk, and just swapping out milk for ideally soy milk, but there are so many great plant-based milks out there, can be it might feel like a small change, but it's doing a lot of really good things for your health. So yeah, my two recommendations would be start with those red and processed meats, and then look for other small changes you can make that maybe don't require a huge shift, but can have a really positive impact on your health.
Awesome. And I know like the soy milk products versus regular milk products are the most biologically similar in terms of how much protein you get, the kinds of protein you get, the other minerals like the calcium and magnesium and stuff, which I think they might fortify both products like
Mhm.
regular milk and plant-based milks. But the soy milk is the most biologically similar to regular milk with in terms of like complete proteins and stuff like that.
That's exactly right. Yeah. So you mentioned complete proteins. We know that if you're eating a well-rounded diet, that's, you're not just eating one food every day. That's going to give you a nice diversity of the protein types that you need. But yeah, soy milk and soy products generally are made up of a really nice profile of these building blocks of protein that your body really loves and thrives off of. So just yeah, another plug for using soy milk and tofu as well, tempeh. There's lots of great soy-based options out there.
Oh, awesome. And yeah, we're also going to put the link to our video from the Senate Committee on Aging, where they talked about something they called plant-forward pescatarian, but with plant-based being like the ideal. But both are, steps towards increasing longevity and having a better aging process where you have fewer chronic diseases, if any. So,
Yeah, I think that's good.
it was really great meeting with you today, Noah. I really appreciate your taking the time to have this discussion with us.
Absolutely. Thank you so much for having me. I really enjoyed it.
Thank you so much. Have a great day.
Thank you. You too.